Right. Today, today also we are going to discuss about the AVM, arterial venous malformation. This is the inside the brain. The arterial network connect to the venous return. That area is marvelous. Divide the arterial branches. Lot of branches are connect to the lot of venous branches, like a thread ball like situation. It's go to the return to the heart. Then that point is the sometime it is the dangerous situation can happen inside the brain. Right? We have discussed the previous day some form of things. Today also the discuss middle cerebral arterial supply of the brain, internal and cortex area. The left side brain is the dominant side. The left side circulation mainly we discuss. Due to this arterial vein malformation, how we can identify the before due to that localized incidents, how we can identify the before that situation. We have discussed some form of visual problem, visual dilatation problem. It is identify the patient go to the bed in the night, the lot of light come to the eye, it can't bear that patient. There is also some form of symbol we can identify the arterial vein malformation inside the brain. Why he can't dilate and constrict the pupil. Another one, the visual, another situation, when he sees some form of distance pictures, when he can properly can't get that picture, the double vision, diplopia can be occur that patient. That is also the another visual situation. Another thing is the some form of anterior aspect of the eyeball, the pain go to the lateral side, then pain go to the middle sagittal area, go to the back side. The severe pain can be happening to the brain area. It's also another symptom. The hand function of the dominant hand function problem, leg problem, hip area pain, trunk area problem. He can gradually feel this situation. Right? The before, how we can identify the arterial vein malformation. Then the after damage also there can be first damage. The first damage can cure the some form of the 5-month, 10-month likewise. The second damage also can happen. Third damage also can happen. This 1, 2, 3 damage, can be the worst situation. Then how we can identify this second damage, third damage, how it's correct that brain. Right? Today we are discuss the this cervical of villi. The briefly go to the discuss. This is the posterior side circulation. We know the vertebral artery, both connect to the vertebral artery, the basilar artery, the downward go to the spinal artery, vertebral artery connect to the basilar artery. The basilar artery give the some form of Main posterior organ, we know the organ, cerebellum, posterior inferior, pica, ulca, anterior inferior cerebellar artery, superior cerebellar artery. This is the labyrinthum. These arteries go to the sometime ear. We can identify the some form of hearing problem also. Damage this arterial area. The hearing problem also they can be occur to the middle cerebral arterial area damage. Then the basilar artery divide the posterior cerebellar artery. It's connect to the posterior communication artery. This is the ring area. The middle cerebral artery connect to the anterior carotid artery. The anterior carotid artery. This is some form of ring-like situation. It is the most prominent dangerous damage can be happening area. Why the circulation come to the three sides and can be the aneurysm can be happen this middle cerebral artery near area, middle cerebral artery posterior communication. Then the anterior cerebellar artery, this is the anterior communication artery, communicant artery. This vehicle of villi, we are discuss this some form of aneurysm, some form of stenosis, some form of malformation of the artery, previous things we discussed the previous program. Right, due to this middle cerebral arterial AVM, this area we know the homuncles also the most important. This is the coronary section, cut off the coronary section, the brain cut off coronary area. We know this area, the genetical area. This is the leg, toes. This area also the toes, leg, trunk, toes, foot, leg, knees, thigh, trunk. This area also the trunk, neck. You know the trunk, neck, and hand. These are the finger area, hands, finger area, and the face area. This area also the face, the tongue area, face area, tongue. When we consider the leg area, hand area, face area, tongue, this area, we can identify the arterial supply of this cortex. When the damage occurring to the arterial supply area, how we can identify the area? This is the DSA check. DSA check is the most important check. DSA check or MRI check or CT scan. DSA check is the most important to inside the brain identify the local area if the visually can take the picture to properly can identify the localized area. That's the most important DSA check. MRI also has some form of check. We can identify the AVM occurring localized area. CT scan also the can some form of checking that area. This DSA check, MRI check, and CT scan can identify the middle cerebral arterial AVM area. That is the most important point to how to before understand this AVM situation. When the first patient having some form of little bit sign and symptom, go quickly DSA check, then he can identify the what is the area it's situated, distal part of the brain or internal part of the brain. Then it is happening to the internal part. That is the sometime dangerous. The distal part we can treat the surgical method and skull remove and then can surgically correct this area. Sometime radiation therapy also can be applied. Right, discuss the AVM problem little bit. AVM, how can identify? DSA check. This is some form of color applied to the arterial supply. Some form of color applied to the arterial supply, and color go to the arterial and it's block the color and distal part no going to the that color, and DSA check we can identify the that point. And MRI, this is also a scanning method. That is the we can identify the that point, and CT scan. Right, before we can identify the AVM, before this is the treatment, surgical treatment can the some form of skull remove and can go to the surgery to correct that area. Then radiation therapy. The laser therapy. Laser therapy can apply to the burn that other nerve, other arterial and veins. Yeah, burning and it's correct. Then we can go to the blocking that arterial, block embolizing and choline. Then the coagulation also we can apply the some form of coagulation blocker. Anterior coagulation blocker apply and posterior it is not to go into the furthermore and block the arterial vein and arterial area, block the venous end. That is the blocking embolizing system. Radiation and surgical radiation and blocking. This blocking method also the most important technique. How we can go to the brain area, how we can go to this brain area, go through the thigh, go thigh arterial, the femoral arterial, and through the femoral arterial go to the heart, and this is the aorta and the carotid arterial supply go through the, and then the middle cerebral artery and go through and block that area. The DSA check-in and visually that watching area and through go and block emboli situation. Embolization also that we can have do the some form of blocking. Some form of wire can be applied. The go through the das wire, the lot of wire applying to this area and block, and some form of coagulation drugs can be applied. Likewise, several things can be done. Sometime but clipping also, they can the blow holding apply to the brain and go through the and clip this arteria, then block the supply of furthermore. Right, we are discussed the some form of middle cerebral arterial AVM situation. Now we are talking about the after AVM damage, how we can correct the AVM area. Then we consider the homuncle, the patient also, we are drawing some form of small patient, like this is my picture, this is the leg. The AVM, another situation, the convulsion can be happen before convulsion or epilepsy. Convulsion, epilepsy can be before identify this situation. Convulsion also epilepsy, both are same idea. Convulsion, epilepsy, or some form of memory problem also can be happen. The fluent of speech problem, the fluenting of speech, sometimes blocker words come blocking to the out and can't correct and fluency speech. There is also the comprehensive also the problem. They take environmental talking things, can't get the proper, they can't answer the proper. This also that can happen. Then due to the AVM blast, it's blast first situation, first and second situation and third situation. Like first we identify the AVM, the paralysis of the arm, paralysis of the leg, some form of speech problem, some form of visual problem. The therapist can identify and give the proper therapeutic method and give the proper intensive therapy and correct this situation. Then the patient can walk properly, can do in some form of activity properly by using hand. The cognitive function also the normal. His first situation he is correct. There is second situation, there can be happening the second damage. Second damage also the blast the AVM area. That is the most difficult. To blast the AVM area is the most difficult. To blast the AVM area, the lot of damage happening to the patient. Hand can't move. The ignore the side. The leg can't move. Is also the the first time is also the intensive care. Intracranial pressure also the go high. The intracranial cognitive function damage. The visual function also the damage, a lot of damage. The speech problem, swallowing problem, a lot of happening to the brain. And some form of pain go to the hand and leg trunk area, the homuncle area. The legs can be some form of survival. By the legs also the give the arterial supply not to the middle cerebral artery. Legs also give the anterior cerebral artery. This is the leg can be we can cure the leg quickly. That's the most important. That we can walk. But hand is the problem. The hand distal area is the most problem. Finger is the most affected because of the finger area. finger area also, this area, the middle artery supply to this problem. The finger, face and tongue also the lot of damage. Finger is the lot of damage, the extensive of the wrist is the lot of damage there. Facial area also the damage, but facial area give the to supply. That is the most important thing. Facial area also to give the cranial nerve supply. To both supply give the simultaneously facial area. The support to the other area to the opposite area. The hand also the not likewise. The hand also the separate. This is the separate area. This is the separate area. Not to the give support this area. This area. Face also the support that mouth. This side support to the this side also. Visual also support. Facial expression also a lot of support to the both sides. Then the cure we can the facial expression, the leg, hand also the lot of problem to cure. Then the speech problem also the most important to discuss. The memory, speech, the personality problem. Because of these are the young adults people, the personality lot of damage. He can't to gather the society, gather the friends, and can't sport, can't expose to the society. Communication problem. A lot of damage to the emotional problem, the behavior, emotional, personality. Those are the go fully down. That is the most important to discuss this area. This is psychology is also the most important to approach this patient and how to cure this person. The AVM discuss the some form of brief idea about this AVM. Then the how we can improve this ADL. That is the most important. ADL also the most important to improve. The adaptation, modification we can give the. It is also the treatment method to correct the hand and leg and other area. The ADL most important. Then the most important, this is also the student, the education problem. The education problem also the most important discuss. Then the activity. Leisure activity also the most important to discuss. They are the young adult, the play activity also the most important. Skill gaining also the most important. Skill, how we can gain the skill. And the personality and other brain cognitive function. Cognitive function most important. Ambulation also the most important too. Ambulation. Those are some form of things we have to gain this young adults person to happen AVM damage. How we can gradually cure this patient. This is the some form of muscle strengthening activity, the functional activity, the adaptation and modification, the education, adaptation and modification, the speech, how to gain the speech modulize and speech moderate, the computer education supply. Those are the we have to discuss this young adults AVM patient. This is the most important. Uh, Another special point to we are going to discuss this first, second, third damage. The first blast also happening, but this patient damage is the more internal. This is the most internal. The damage also the most internal. Can't go to this damage area. Can't reach to this damage area. Can't surgical approach. Can't laser if the can't block the arterial embolism, can't clip in this area, then it is blast. What happened? The more lot of blood collects in this area, the compression also the go high. uh, the surgical method, one thing is the evacuation of the blood, the blow holding apply and evacuation of the blood is most important. Or sometime they remove the skull, that is also the most important. Why we can't reach this place? The brain expand, the intracranial pressure go high, the skull can't give the more space, the skull remove, then give the space to the exposed brain. That's the most important another thing to the second blast area. The some patient happen to the second blast, they can't go to the surgical method. That surgical method also they ignore, don't want to surgery, don't want to laser apply. You have to stay calm and quiet and don't waste a lot of energy. The meditation apply and don't brain use a lot of functionally calm and quiet. You are living this society, you can correct some form of previous days this AVM, arterial vein malformation area. That is all that can happen into the some form of after blast second surgical method not apply to the patient, but he is cured gradually and he is totally normal. He can walk and he can education. He is always the bright person and he is stress reduction situation. He can live long. That is the most important third point. Right, we have discussed the some form of AVM. AVM also the arterial vein malformation. Uh, the convulsion also the happening. The convulsion treatment also the continue to neurologist how it is managed. In convulsion also the can correct this patient. Right, we have discussed the some form of special thing about the middle cerebral arterial damage. Due to this middle cerebral arterial vein malformation, what happened to the arterial vein malformation? It is the some form of teenager area, 13, 15, 16, 20, 25, likewise teenager area. Some stress can happen into the brain and more blood pressure applied to the brain, and it is proximal arterial or distal venous return can be blast. Lot of malformation area, the we know the malformation area, the arterial and venous arterial venous malformation area. There are third three layer of the arterial and venous. This is the lumen, endothelium or epithelium. Likewise, three layers we can identify. Then the some form of stretching situation, elastics, fibers areas, and then epi epithelial areas, and those areas not properly growth this arterial supply. Due to this reason, the malformation can be occurring to the inside the brain. So a lot of pressure applied to inside the arterial perfusion, then the can be blast some form of area and hemorrhage can be out of the lumen. That's the some form of situation We know this situation, right? Discuss these things briefly. Now we are going to the another special things to middle cerebral arterial situation. It is also the discuss the next program. Middle cerebral artery. Cerebral artery. We know the AVM is the most important. The aneurysm. Aneurysm. This is also the arterial problem. This is AVM is the arterial and venous problem. Then the stenosis also the arterial problem. Stenosis. And the dissectant and stenosis, aneurysm, AVM. AVM aneurysm is the most important, the berry aneurysm. Stenosis is the circulation. This is the circulation supply. This is some form of blocker. This is the internal carotid artery. And external carotid arterial supply. This is no go to the internal area, a lot of blood go to the external area. Steel circulation, we know the steel circulation also the happen into the some form of situation. Stenosis or some form of circulation, blood go through the arterial supply. Right, now today we conclude these things. Next day we are going to discuss aneurysm. Thank you.